Hey everybody, I wanted to quickly talk about the concept of facial slimming. So some patients come to the office and complain that their face is too wide and they'd like to have a slimmer face. And so it's not as simple as just one simple procedure to slim someone's face, and you really have to figure out what it is that's giving them that wide appearance and what we can do about it. So if we start talking about what's going wrong in the face with having too big or too wide of an appearance, usually these people have their entire life kind of had this moon cheek appearance, or big chubby cheeks, chipmunk cheeks as some people like to call them, and they just never really, they say, get better when you get older, and then as they get to their 20s and 30s, it never gets any better, and so they want to have a fix for that. And so there's three main procedures that we are going to talk about, which encompass facial slimming. So one of them is buccal fat removal. The other one is Masseter Botox, and the third is facial fat grafting. And the whole concept of all three of these procedures together is to create contours and shadows and highlights of the light when they hit the face, so that when you have, the ideal facial appearance and the ideal facial shape is a triangle like this, where most of the volume is up high. So it's an inverted triangle. And then as we age, it typically changes where it goes the other way, where your volume drops. Now, it doesn't just happen when you age. If you have a lot of your volume down low, it's going to focus that appearance and that width down here as opposed to up there. So we want to kind of change and flip that triangle to give it a more harmonious and slimming appearance, where it kind of tapers down from the cheeks all the way down to the chin. So the biggest things that we have to talk about is you have to figure out why that is happening for each patient. It's not as simple as just one simple procedure, as I mentioned before. And so some of the areas to think about, it's just the interplay of the cheekbone here that we like to have very high, and that's where we do things like filler, or we put fat in, and we try to accentuate the cheekbones in this area and create kind of a big mound or a highlight that the light is going to hit. And then similarly below that, in this area below the cheekbone, we usually typically want to subtract some volume there. So if we build up the cheek and we subtract volume down here, this is how we're overall contouring someone's face, so that we really can make that triangle inverted again. And so the first procedure we can talk about in terms of subtracting is buccal fat removal. So buccal fat removal is very popular right now. There's a lot of videos on YouTube and social media and Instagram as well, where people are doing buccal fat awake in the office and taking it out. And so the buccal fat pad is a very deep fat pad that lies right here. So it's not back, it's the front part of the cheek in this distribution right here. And so the fat pad is just underneath the inner lining of your mouth. And so when we remove the buccal fat, we make two small incisions inside the mouth, we get that fat pad out, and we can remove it. We don't want to take the entire fat pad, because that fat pad actually doesn't go away entirely as you age. So you do want to have some volume there. It's important to have the gliding plane that fat gives. And similarly, that fat pad is attached and connected to the temporal fat pad all the way up here. And so the signs of aging, if you take all of it out, are really going to accelerate, and it's not going to have a really favorable appearance to the face if you take all of it out when you're in your 20s and 30s. And you're going to really notice it when you're 40, 50, and 60, because you removed it entirely. So if you do have a lot of volume in this area in the buccal fat, then that might be a really good procedure to start the slimming process in your face. And one thing that we like to do in the office to kind of mimic the effect of what buccal fat removal can do is just by sucking in your cheeks. So by doing that, it kind of mimics the appearance of what removing some of the buccal fat will look like. And so if that's where the volume is, and you feel like you're looking better by doing that, and that's the result you want, then that might be the best procedure for you. Similarly, if your volume is not here in the front, but your volume is here in the back, then here, this is more of the muscle. So this is the masseter muscle. So when you bite down, you have two big muscles on either side of the jaw that activate, and you can feel them between your fingers. You can feel them. And those are the masseter muscles. So if we're talking about trying to make those muscles, which are too big, and giving you too wide of an appearance here, make them smaller, what we use Botox. And so as we talked about before, Botox knocks out the activity of the muscle. And so if you're not using the muscle, you lose the muscle. And so you will start decreasing the size of that muscle over time at having given Botox. So you can inject the masseter muscle just like any other thing using Botox, and that will start slimming this area as well. So now we've talked about the front part, and the back part below the cheekbone, where we can start reducing volume if you need it. And the last component to this as well is that if you need to subtract here, we also want to add volume on the cheekbones. So if we're going to add volume on the cheekbones, what we need to do is start talking about facial fat grafting. So we harvest fat. We've talked about this in another video. You harvest fat from either the belly or the thigh or the butt. You purify it, and then we can use that to graft into the face and add volumes, much like filler, but it's more permanent. And so we can fat graft and add volume to the cheekbones. So now we're creating some positive volume up here, and we're subtracting volume down here. And when we do that, we're creating a much slimmer and a much nicer contour to the cheek. And so those three procedures together are really how you can effectively tackle someone who comes in and complains that their face is too wide and they want to be more slim. The important thing to remember is that neither of these procedures is a one-size-fits-all for slimming. You really need to know what the underlying anatomy is and why that is contributing to the process of making someone feel too wide. And so if you don't effectively treat it and you're just taking buccal fat out on everybody, you might not get the ideal result. And it's much more about an artistic process where you're contouring the face by using these three procedures together to really give someone the result that they desire. Well, thanks for watching, and if you guys have any questions, let me know.